Now we're moving on to an example of implementation research in the field. Let's see how community workers are actually making a difference by implementing the evidence into the community. So we're joined by Ika. She's an amazing researcher, and apparently she also had an education in Canada at the University of British Columbia. What an amazing story. And she's an expert on people who use drugs. So Ika, why don't you introduce yourself and let's learn more about your work?
Yep. Thank you for having me here. And I'm very grateful to be given this opportunity to share what we're doing here in Malaysia in terms of implementation science. My name is Afiqah Mohd Salleh. I'm a senior lecturer here at the Department of Social and Preventive Medicine, Faculty of Medicine with Team Laya. I'm also a research scientist at the Centre of Excellence for Research in AIDS, or what is known as CHERIA, in University of Malaya. I completed my master's in public health at the London School of Hygiene and Tropical Medicine, and then I furthered my studies at the University of British Columbia, focusing on interdisciplinary studies. It's a discipline that looks at the integration of sociology and medicine together.
Wow, she's so well accomplished. A very inspiring story, but I can see the humility in her eyes. She really wants to impact Malaysia, and I think that's what led you back here to your motherland, right?
Yep, that's right.
And I think that's one step of making global health accessible to Southeast Asia by going home. And that's one of the prospects I'm thinking of after I complete my global health degree. And I'm happy that Canada has welcomed you at one point of your life. So the next question is, why do you want to study people who use drugs? Out of many topics out there, why specialize in this topic?
Right. So I don't think it's it's an issue that a lot of people would feel comfortable to talk about. Because there is so much stigma attached to drug use, and also HIV. So my ambition is to look at ways how I could challenge my own traditional ways of how I think drug use. And I see that there is a lot of misconceptions about drug use here, not just in Malaysia, but globally as well. And also looking at ways how I could, navigate through these different social institutions, be it healthcare, beyond healthcare, the education system, and see how we can look at ways to improve the lives of people who use drugs, especially those who are impacted by HIV.
Wow, she looked at the interdisciplinary approaches of this topic, right? A lot of people think it's just a health issue, but it's also an educational issue.
That's right.
It's an economic issue.
It's a legal issue.
It's a legal issue. And that's the beauty of our sustainable development goals.
Right.
Because they're very interdisciplinary. You cannot achieve one goal without achieving the others.
That's right.
So which of these goals actually resonate with you in a personal level?
I think one of the goals is look at ways how we want to reduce inequalities among people who use drugs, because when we look at the legal impact of people who use drugs, a lot of them are being criminalized because of their personal drug use, although this is minor drug offense. So what it does is that we're talking about criminalization, mass incarceration, not just in the US, but we're seeing mass incarceration in the Philippines as well. And also 60% of the prison population in Malaysia are among people who use drugs with minor offense. And I think this is not the right way to do it, because what we are seeing is there is an issue on, HIV treatment interruption. If people are on treatment, for instance, for their drug use, I'm not sure if you've heard of methadone before, that reduces the withdrawal for opioids. So people are making use of this treatment as part of their healthcare. We're seeing interruption of this treatment when they are in these settings. So we want to reduce all those risks. We want to make sure that people have continuity to treatment and not having them to go to prison and in the end causing interruption to their medication, causing interruption to their treatment. So what we're seeing is that the war on drugs has become the war on drug users, which is not the way that we want to go with, right? So having this sort of thinking how we can go about criminalization, and right now we are big on talking about decriminalization, right? So I think that's one of the ways that we want to move forward with, to ensure that people have access to harm reduction services, people have access to treatment better, and people have access to social services, and most importantly, people are not taken away from their families.
Okay, so like you really touched based on something personal, because the war on drugs did affect my country personally. You know, a lot of issues that are so systemic that continue to happen, and we don't know it. We don't know how to stop it. That's the problem. And I'm so amazed that there are researchers like you who even care about countries like mine. And so you talked about your work, you introduced it to us, but like, what are some initiatives in Malaysia that could be addressed? Like, like particularly those that you think are success stories on the drug issue in Malaysia.
Right. One example that I could think of is the harm reduction initiatives that have started in the country back in 2005. So through harm reduction services, we are providing clean needles to people who use drugs to prevent them from getting HIV and also Hep C. And then the other component of harm reduction is the methadone treatment that they take rather than taking heroin, so that they can function well, they can live better, they can go to work and have functional family relationships. So that's the goal of having harm reduction in the country. So we're seeing success stories in terms of how we work closely with non-governmental organizations, the NGOs, the community-based organizations. And among these community-based organizations are people with lived experience, people who understand how critical it is for people to access these life-saving interventions. And having these people who are also peer workers work together with people who use drugs, open access to hidden populations. Now people are becoming more and more comfortable to seek healthcare. People are getting more comfortable to reach out to these community-based organizations or the peer workers to say that I need help, and having them to be referred to methadone, or having them to receive these clean needles. So what we're seeing over the past few years is this huge decrease in new HIV cases among people who inject drugs, right? We are not even seeing, it's very uncommon for us to see people who are actually injecting drugs. So back then there was this huge controversy on, you're providing clean needles, you're providing the harm reduction services, you're only condoning drug use and things like that. So there is a huge,
like
debate,
misunderstanding
about what harm reduction is. But we're not seeing that. We don't see increase in injection drug use. We're seeing decrease in injection drug use. That's the trend that we're seeing now in Malaysia and other countries that have done harm reduction before. So I would say that this success story of how this partnership between the Ministry of Health and also community-based organizations have open access to hidden populations, making them come forward to seek help, to seek treatment, and finally seeing this huge dramatic decrease in new HIV cases among people who inject drugs. So that's a success story that I would like to share with you.
And indeed, it is very successful.
Yeah, it is.
It's successful.
Yeah.
It's inspiring, and I think other countries can follow.
Yeah.
I think it's such a good example for other nations that with harm reduction policies, you're not just safeguarding the people's health.
Yeah.
But also like the people around them.
That's right.
Because drug use affects even the families, even the people in the community.
That's right.
It takes a village to heal, our population. And I'm amazed at the story of how this simple policy could actually impact the lives of many people.
Right.
And to make those policies possible, we actually need research. And in the context of implementation research, how do you think can that accelerate harm reduction and, on policies on people who use drugs?
Yeah. So recently my research team and I have embarked on a research study called the Semarak study. So that's a study on HIV services among the Malaysian people who use drugs. So using the APIS framework within implementation science, we looked at how we can engage with community-based organizations. So we have not seen this within the implementation science framework, but we did this using the APIS framework to see how we can leverage on the roles of these community-based healthcare workers in the suburban areas of Malaysia. So what we did was we coached them. We coached the community healthcare workers, and then having them link these people who use drugs to respective services. If they are in need of methadone treatment, then these community healthcare workers would then refer them to treatment. If they're in need of needle and syringe, we would then ask the community healthcare workers to provide clean needles to them. Hep C, hepatitis C, and also HIV, if they are positive, we would, these community healthcare workers would then link them to respective services. So what we're seeing is that we're seeing an increase in the number of people who are engaged in these services over time. But then again, there are also issues on criminalization where, we're seeing missing participants along the way because they have been arrested at one point. They went to jail, they went to prison. So what it does is that it's going to interrupt the continuity of care. We already have the services in place, but because of the policies that kind of criminalize drug users, I think it's a one big barrier in effectively engaging these people into care.
It's amazing how we look at it as a global health issue.
Mm-hmm.
Like if we treat them as humans
Mm-hmm.
who are in need of help in
Yeah.
terms of health, then maybe we could help them better.
Yeah.
I don't think criminalizing them right away would solve the
Yeah.
issue. I thank you for agreeing.
I would agree to that, definitely, 100%.
I
Yeah.
think a health-based solution is the way,
Exactly.
is to actually help these people and not
Yeah.
just to put them on a cell. I think that's the better way to
Yeah.
rehabilitate them, especially back to society.
Yeah.
And your work is so amazing. It's so
Thank
inspiring.
you.
And you did mention a while ago on the impacts of this in the Philippines, like drug users or the war on drugs.
Yeah.
But like, how does it look like in the rest of Southeast Asia? And do you think the policies set in place are not, ideal for these people?
I think Malaysia is doing really well, as I've mentioned just now. Thailand, Bangkok, they are big on having these NGOs to work closely with health agencies. So I think that's going really well as well. Cambodia, I'm not sure if you've heard of the 95 goals of HIV, in a way that the target is being set by UNAIDS, so that 95% of the population who are HIV positive know they are HIV positive, and then 95% of them who know their HIV status would be started on treatment, and then 95% who have started on treatment would have their viral load suppressed. So Cambodia is one of the countries that achieved these 90 goals. So I think that's really impressive in how we look at how Southeast Asian countries have progressed really nicely towards getting towards the elimination of HIV. Yeah.
And that's interesting. I think sharing these examples is a way of decolonizing global health,
Yeah.
right? Because like people might think, oh, they're the Southeast Asian countries. They can't manage their own diseases. But it's interesting that we actually have success stories that we can share to the world,
Yep.
that it's possible if you give us the platform
Yeah.
and the advocacy to work on it.
Yeah.
And it's amazing you've documented these stories
Yeah.
all over Southeast Asia.
Yeah, it is.
But like for young people like me, you're also quite young. we might be scared to enter into research, like people who use drugs, because like
Right.
the stigma around it, like, oh, will we also get criminalized? Will we also go to jail? We're scared of instances like that. So what's your advice to people, early career researchers who want to enter this field and make a thriving career out of
Right.
it? Yeah.
So we need young people. We need more young people to come and join us in this journey of providing better healthcare services for people who use drugs. Because the young people are also affected by drug use. We're seeing more and more young people who are getting affected by HIV as well. And these are people who are in colleges, in universities, and we want to prevent that from happening. So I think one of the things that is a highlight of HIV research is emphasizing on lived experience, right? So the young people would have a better understanding of how they can come about and bring changes to this, research, and also looking at ways how services can actually be tailored to young people. So I would say that it's a very complex field because, like you mentioned, we're not only looking at the individual per se, but we're also looking at the social, the structural factors, the legal issues surrounding drug use, and there's issue on stigma as well. So I think what I would recommend to young people out there is try and challenge yourself in looking at ways how we can improve things, especially when it comes to drug use. We need to, how they say about emptying your cups and then filling it with new knowledge. So I think that's what we can encourage young people to do, to challenge our own traditional ways on how we see drug use and looking at how we can be innovative in providing support, in thinking about what research can be done to promote better health for people who use drugs.
Okay, I'm literally starstruck right now because I needed those words right now too because for global health scholars like us, there's so many global health issues.
Right.
We want to address them all, but we have to specialize in something.
Right.
When we specialize, we might not solve all issues. But if we solve one issue, then I think we can change the world for the people who are, living that issue right now. And for you, it's people who use drugs.
Yeah.
It's very inspiring. So thank you so much, Ika, for sharing me these stories. I came into this interview thinking, we're just going to be talking about the rehabilitation side, the medicine that's needed there.
Right.
But we also touched on equity.
Yeah.
We also touched on issues that, looking at the social determinants of health to address these issues is actually key to making it a better world for the people who actually need our help right now.
Yeah.
So thank you so much, Ika, for joining us.
At all.
And
Thank you.
more power to your work. Yeah.
Thank you.
Okay.